So thank you very much for inviting me, Mahuja, to present our research. Actually, this research was conducted by me, Dr. Andrew Jolly, who is now at Plymouth University, Mahuja herself, and Sam Pryke from Wolverhampton University as well. And so the title of today's presentation is the Joint Strategic Needs Assessment, JSNA, of the current and future needs of the migrants living in Birmingham. Oh, great, it works. Can you see second slide? Just double check.
Yes, thank you.
Great, thank you so much. So yeah, for this presentation today, I will start by saying a little bit about what is actually Joint Strategic Needs Assessment, why including migrants in such assessment is needed, is it needed? I will ponder about that a bit. Then I will talk about a little bit about research context, but very briefly, and also who commissioned and why they wanted this JSNA to be conducted. Further, I will talk a little bit about methodological approach that our research team chosen to perform this assessment. And finally, the meaty part of this presentation, I will talk about our empirical findings, then to just conclude and suggest some key points that should be taken on account in Birmingham when thinking about including migrants in needs assessment, or rather in planning commissioning work with migrants based on needs assessment. And I will mention a bit about acknowledgements, because there are several of wonderful organizations and people helping me accessing migrants during this project. So first, I will start with saying what Joint Strategic Needs Assessment is. And it's important to understand that actually this assessment is not comprehensive academic research, but a critical part of the process of commissioning. And as Rose et al. Said, it's kind of focuses these areas of concern on the areas of concern that warrant changes to provision, to longer term strategy, or to areas needing further focus or assessment. So through this particular needs assessment, we identified gaps in service provision and developed a set of recommendations aimed at improving and/or changing existing services directed towards migrants, in this case, living in Birmingham. So it is important basically to acknowledge that it is not a piece of pure academic research, although we have gathered new data, and one could argue that gathering new data and analyzing this data, it is a research, but it is important to acknowledge and distinguish between like pure kind of academic research and performing this joint strategic needs assessment. And JSNA, as I mentioned, is assessment that should help to commission further changes in provision of services to anyone, but in this case, to migrants living in Birmingham. Local authorities are kind of obliged each couple of years to perform such joint strategic needs assessment of their populations in general. And if there is a significant amount of migrants living in the area, then such assessment needs to include them, or one can perform two assessments, one in general for population, and then perhaps if there are specific needs of migrants living in the area, then an additional JSNA is performed. So in terms of so these needs assessment are around well-being and health, but determinants of health of migrants are various. And there are a number of determinants of health and well-being for migrants. Some of the most important determinants are barriers in accessing really any type of services or basic rights and entitlement. And entitlement to healthcare services does not guarantee that immigrants have fully accessed the existing services, or indeed want to, or are not afraid to use those. There are, for example, personal, financial, and organizational barriers to accessing healthcare. Migrants also, alongside social and cultural barriers, encounter economic barriers when accessing healthcare. And also, what I think we need to acknowledge is that migrant experiences are hugely different. So they vary hugely depending of immigration status of the migrants, but also on other existing vulnerabilities. So for example, if we take unaccompanied asylum-seeking children, his or her needs are vastly different than, let's say, highly skilled a migrant worker who is on highly skilled types of migration visa, working visas, right? So for example, in terms of unaccompanied asylum-seeking children, accommodation and housing needs, health and well-being needs, educational needs, legal and representational needs are really, really different. And especially this legal needs in terms of related to their status as accompanied asylum-seeking child, and the ways in which such child then claim refugee status, let's say in UK. So here you can see graph prepared by this various researcher that kind of distinguishes between several determinants of health and well-being for migrants. So first, as I said, there are these own characteristics like age, gender, ethnic group, past and current medical history. Then we have behavioral factors. So if someone's smoking, using alcohol, diet and exercise, which is true to anyone, not only migrants. Then there is ability to communicate. So language spoken, proficiency in language in host country and all that. Then country of origin. Because in public health, especially, there are some burden of diseases and infectious diseases associated with certain parts of the world. So those things are also important. And then, of course, circumstances resulting in migration. So if someone is a refugee from a conflict zone, their needs, let's say, associated with their mental health care can be vastly different, yet again, with highly skilled migrant or student migrant. And then nature of their journey, right? So if someone came to UK quite smoothly in terms of a process, if someone walked through desert and then through Mediterranean and then end up in UK as a result of fearing of persecution in their own home country, then their experiences and this nature of journey shape also their mental health and also physical health and well-being. So some of those journeys are really prolonged with uncertain outcomes and physically dangerous with poor hygiene and sanitation and all that. So all of those aspects yet again influence or may potentially influence their situation. Then there's arrival and settling process in regards to living in UK. So often some migrants may end up in poverty, experiences grief, isolation, homesickness, racial harassment and anxiety, and so on. Then asylum process itself can influence, and we do have quite a lot of existing research to show how this uncertainty of outcomes of process and associated despair and stress of the asylum process can influence asylum seekers' health, both physical and mental. Then housing issues, so the quality of accommodation, landlord practice, and so on. And then employment factors, so kind of work depends on, yet again, status, right? So some people are unable to work or cannot legally find employment, which I will talk a little bit about this later on. And finally, there are also other kind of determinants of health and well-being for migrants associated with access to services. So, for example, lack of understanding or awareness of social service options, unfamiliar systems and language differences, and so on. So sometimes people are really used to the healthcare system that they experienced back in their host countries, and this shift and getting used to new type of healthcare services causes a lot of distress, and those services often are problematic to access anyway. And all of those here, like factors, do not exist in by its own. So people have several of those issues, or those determinants are rather interlinked, usually for an individual, an outcome for this particular individual. And you may ask, like, why actually one should include migrants in a joint strategic needs assessment process? And it is important to include them both to improve the well-being of migrants themselves, but also because migrant inclusion benefits wider local society in a variety of ways. And for example, like JSNA really is about social justice and is an essential part of addressing health inequalities. But also it's a key component in generating community cohesion, or in general community togetherness or conviviality. Furthermore, it is integral to the economic well-being of our society, and it is about continuing to address the needs of the most vulnerable members of our society and enabling their full participation. So including each and every type of individuals living across the Birmingham in this case is important, because it's not only about them, but it's about wider kind of public health, cohesion, and integration. In terms of research context, I understand that everyone is who is joined today is based at Wolverhampton University. So I do not want to spend too much time here discussing kind of migration in Birmingham in terms of numbers and all that. That's very easily to find online. But I would like to say just that actually this JSNA was commissioned by Birmingham City Council and was performed through Institute for Community Research and Development based at this university. And it was kind of, for me as a researcher, encouraging to see that actually Birmingham City Council was really serious about learning about difficulties in accessing various services by migrants across the city in order to then better make the better decision while commissioning services across town. So that was quite important. And in terms of methodological approach, well, yet again, due to our time constraint, I don't want to spend too much time here, but we had like 4 phases of our research. In first phase, we use existing quantitative data that we could access through Birmingham City Council, but also from census and all that. Details can be found in our JSNA that will be published soon. However, I would like to highlight here that accessing NHS data on various populations across the city was problematic, but yet again, I understand that quite a lot of you work with in health research, so you understand that it's not easy to find, it's not easy to access health data from NHS, and especially health data from NHS by nationality of the individuals. So we had some issues there. Then we interviewed some of the stakeholders working with migrants across the city. And we had 30 semi-structured interviews and 1 focus group with 6 stakeholders. And further, we interviewed migrants themselves, as well as we conducted focus groups with them. And we conducted migrant survey, and migrant survey was with 76 participants, and it was 53% of participants were male and 47% were female, and participants had lived in Birmingham between 1 year and 41 years. And participants were born in 32 countries, and 11 of our participants had become British citizens. So as you see, participants were born in 32 countries. This in itself tells you quite a lot about sorry, I was distracted with that note. So as you can see, participants were born in 32 countries, which tells you a little bit about the nature of migration in Birmingham. Here, I just wanted to mention for some of you maybe that are working with quantitative data, there are difficulties of serving migrant population in UK, and this has to do with the lack of really kind of registering, consistent registering practices by UK. So, of course, we do not claim that our research is in any way of shape or form representative quantitatively. And I can answer some of additional questions if there will be some about that later on. Why is it so, and why it's so difficult to survey migrant population in the UK. And in terms of findings, I've chosen some of the most important findings. Yet again, you can access our JSNA soon with more details. So, firstly, living in Birmingham. Participants came to Birmingham for a variety of reasons, for work, study, or as a result of claiming asylum, were the most commonly described reasons by them. 66% were either very or fairly satisfied by their local areas as a place to live, but this was stratified by immigration status, and 21% were either fairly or very unsatisfied. When asked further about life in Birmingham, 52 of 74 respondents, and here I'm talking about survey, believed that Birmingham welcomed people from other countries. 49 agreed that Birmingham had good job opportunities, and 45 thought that Birmingham offered a good quality of life. Furthermore, 43 out of 74 felt that they belong in Birmingham. 62 said they had people from their own countries to talk in Birmingham, and 59 agreed that they were able to participate in their religion freely. 67% were satisfied with their life in Birmingham overall. And in terms of qualitative interviews for this part, interviewees were asked about their perception of Birmingham and feelings of safety and security in place where they live. And the vast majority of them expressed their positive experience of living across the city. However, I will mention later on when I talk about safety and kind of experiences of racism that that doesn't kind of align with our findings from living in Birmingham in general. And I should also mention that I left some chosen quotations here for you to perhaps have a glance at when I'm talking about our findings, because I think it's important when working with any respondents, in my case with migrants, usually to kind of let them speak with their voices and tell us about their experiences. And some of the quotations are by stakeholders who are stakeholders that work with migrants across the city. And in terms of social networks, survey participants were well connected and integrated. 71% took part in social activities at least once a month, most commonly eating out at cafes and restaurants, going to bars, attending places of worship, going to gym, and so on. 64% talked to people from an ethnic or religious community different than their own. And a further 25%, 2-3 times a week, also spoke with people not from their communities. So usually in migration study, that's the indicator of kind of integration, when you do not kind of isolate yourself within your own community, or you do not live within your so-called ethnic enclave. They also had a good contacts with friends and family, 71% every day, and further 13% 2-3 times a week. Contact was less common with relatives in their own country of origin, and 32% communicated every day, and 34 to 3 times a week through WhatsApp, Facebook, and so on. However, despite the existence of social networks, and an ability to speak English was sometimes an obstacle in crossing various services, employment, and education. And in consequence, this can hinder integration and social cohesion, which is kind of logically thinking a case that if some of our respondents were less proficient in English, they were unable to socialize, and therefore their connection with others across the city was lessened by that inability. Although spending time with friends who speak the same language kind of fosters social capital that is often conceptual as a resource of information, really, and that can help them and assist those individuals to access various services. There is a need for migrants to associate with others across the city in order to foster integration. So this 30% of individuals who were not really kind of having contact with people other than from their own group, because of that, were less integrated, if you like, although I hate the word integration, but this is another conceptual discussion, not maybe suitable for JSNA. We can discuss this later on in our discussion, maybe why I think so. And all the interviewed stakeholders offered various suggestions for improvements to services for migrants in Birmingham. And the key suggestions here was really being to reduce administrative barriers that prevent migrants' access to local services. And this is not only to NHS, but also to various other services. Furthermore, there were some language barriers following from what I just said before. And this kind of existing research, and there's a plethora of those, shows the important role of language in the well-being of migrants. And proficiency in host country language directly influences migrants' ability to access various services and is associated with enhancement of their well-being. And in our survey, quantitative survey, 59% of our respondents said they were very good or they said that they were very good or fairly good at speaking English, although fewer were confident at reading or writing in English than speaking the language in everyday kind of conversation. Only 51% though thought they were good at reading in English and 49% at writing. So here we can assume also that this inability also to read prevents people to finding information online about various services across Birmingham, and I will talk about this a little bit later on. However, despite the high levels of English proficiency in the sample of survey participants, only 11% had completed formal English training in Birmingham. In interviews, some of the asylum seekers spoke of their lack of access to ESOL classes, and this has to do with their migration status, but also demand across the city that it's quite high, and the lack of resources by NGOs and really Birmingham City Council that could potentially be put towards providing those classes. Even when people are able to speak English, there was a desire for people to maintain existing community languages, and services could be sometimes provided in those languages for those people who are just starting learning English. Despite 59% of survey participants being confident at speaking English, 63% of participants did not speak English at home. Some groups were particularly likely not to speak English at all, or not to speak English at home. One of the stakeholders who worked as an interpreter and translator noted that that this is quite a problematic thing when then those people who do not speak English at home try to access services. And this is particularly true for female participants from some groups. Some migrant women had childcare, for example, some migrant women had childcare responsibilities at home, which meant that they did not have significant daily contact with English speakers. Therefore, their English language proficiency was low. Some of the stakeholders suggested a need for targeted English languages courses directed towards this particular cohort. And this is linked with my next slide, which is about interpreting and translation. So I interviewed several of stakeholders who provide translation services and interpreting services for migrants. And concerns about interpreting services were raised in both stakeholders and migrant interviews. Interviewees, both of them, with limited English proficiency, spoke of their inability to access services such as NHS, and especially, for example, through telephone. And I forgot to mention that this research, this fieldwork was conducted in 2020 and 21. And therefore, of course, during lockdown and pandemic as such, these telephone services, not only by NHS, but other services were dominant. And there were several issues in regards to accessing services through phone due to the lack of language proficiency, but then due to the lack of interpreting and translation services provided. One stakeholder acknowledged the difficulties with ensuring appropriate interpreters to enable migrants to access services. So there was not only an issue with provision of interpreting, but also when interpreters were provided, there were several issues, mainly with the fact that interpretation was not of a high quality and often questioned by NHS employees. General Medical Council guidance stresses that efforts must be made to ensure effective communication with all patients. This includes arrangements to meet patients' communication needs in languages other than English. However, it is clear from the description provided by stakeholders and then all of the interviews with migrants that the lack of adequate interpreting and translation, that is, it is one of the most important barriers in accessing healthcare across the city. Also, several of the migrant interviews suggested the need for better access to interpretation services support, and this was also acknowledged by stakeholders as one of the aspects of improving migrants' access to services. Moving on to income, employment, and volunteering, well, employment provides a mechanism for income generation and economic integration to local society. And most of the interviewees spoke positively about their employment and their ability to earn their living in Birmingham. The importance of employment in migrants' integration is recognized by, for example, Home Office and several existing research on migration and employment. However, some categories of migrants face enhanced risk of labor exploitation. Although many migrants living in Birmingham enjoy economic success and are an integral part of the local labor force, undocumented migrants and those seeking asylum and some temporary migrants face exclusion and restrictions from access to labor market, and as a result can face exploitation from dodgy, let's say, employers. Despite the high educated nature of the survey sample, there were very high levels of worklessness. 18% were unemployed and further 14 were in informal employment. It is important here for me to say also, I'm not sure how many of you work on migration or with migrants, that some type of migrants are not allowed to legally work in the UK and therefore often are forced to engage in work in so-called black markets, sorry. This is really problematic, especially for asylum seekers who often are forced to wait for decision from Home Office on their status for years, during which they are not allowed to work legally. This is something that was highlighted as problematic by each and every asylum seeker that we interviewed. Moving on quickly to housing. Well, there were low levels of owner occupation amongst survey participants, and only 8.5 were living in accommodation they owned. But I guess this is not surprising, kind of knowing housing situation in the UK. 49% were in privately rented accommodation, 12 were in temporary accommodation, and 4 were on a kind of fixed accommodation through Birmingham City Council. There were several issues highlighted in terms of housing, especially by people with NRPF. And for those of you who perhaps do not know, people with NRPF are people with no recourse to public funds for which local authorities are responsible. So those people were really struggling the most in terms of their housing situation. And moving on towards kind of experiences across cities in relation to racism, potential racism or discrimination. And as I mentioned you at the beginning of my presentation, most of our interviewees were quite happy with their lives overall, subjectively, of course, speaking, in Birmingham, and indicated that they feel quite safe in Birmingham. But then their kind of testimony slightly shifted when directly asked about experiences of discrimination. So the vast majority of both interviewees and survey participants felt safe and happy in Birmingham. However, there were a significant minority who had different experiences. 67% of participants in the survey itself said they felt either fairly or very safe in Birmingham, but 20% felt a bit unsafe and 13% felt very unsafe. Only a small proportion of interviewees stated that they felt unsafe in Birmingham. More surprisingly, really, what was more surprising to me at least was the fact that although some of the participants felt unsafe and experienced quite a lot of discrimination across the city, they were really trusting police services, or police forces rather, across the city, which was quite interesting. And 82% of survey participants did not feel felt comfortable to contact police if they needed any kind of help. So that was kind of interesting, this trust in police, if you like. And I would like to mention also a couple of findings here in terms of immigration status and uncertainty and well-being. So as I mentioned, this immigration status is very important determinant of migrants' health and well-being. And this is especially true for asylum-seeking people, refugees, and irregular migrants. Many immigrant populations face uncertainty about their immigration status and uncertainty of the outcomes of this kind of process, and associated stress is one of the most important determinants of health and well-being for migrants, especially refugees, asylum seekers, or undocumented immigrants. Asylum seekers who were interviewed described their worries about the outcomes of their claims and expressed the need for affordable or free legal advice and support for asylum claims to regularize the status quickly. And here, for those of you who may not know, so if you are not allowed to work and then you have to pay for legal services, the question remains how one does that. So this kind of a very unique situation for those individuals creates the stress around this outcomes of their asylum's claim. And some respondents suggested the need for access to legal aid for immigration advice to be free, at least for asylum seekers who are prohibited essentially from working. And speaking of subjective health and kind of well-being assessment that we asked about in survey and then in interviews as well, 79% of survey participants had good or very good health, and 10% assessed their health as fair, and then 12% as poor or very poor. 20% had long-standing illnesses or disability, and 48 of those say that this very much impacted the kind of daily life. What's interesting in migration studies overall, not only on asylum seekers, is that migrants moving to UK usually have better health than people in host country, but this health deteriorates quickly in the country of destination. That's something quite interesting and I think worth exploring further. But this is true to kind of labor migration, highly skilled migrants, but not not when we speak about asylum seekers who usually come with various mental health care issues. And 7% were not registered with GPs of any type of GP practices across the city. So that's quite still significant amount of people in our sample. One of the issues that we kind of think now that it's really important and that perhaps Birmingham City Council could address is the fact that lots of migrants living in there have a lack of awareness about type of services that they can really access. And interviews reported various issues in accessing healthcare in Birmingham, and one of the barriers to accessing healthcare was inability to access information online. So this is linked really with the fact that even though some of our participants spoke English well, they were not able to read and easily access information online. So one of the things that was proposed by some of the stakeholders and migrants was kind of translating information about various services to most popular languages across the city, which is already done, to be honest, but it's usually online, and a lot of our participants were not accessing any type of information about any type of services, including NHS, access to NHS online, but rather through NGOs or places of worship. So the idea by stakeholders and based on what migrants told us could be that those type of information could be in printed form available in various languages in those places of worship and in various NGOs. Furthermore, there's this lack of knowledge about migrants' entitlements overall. So stakeholders especially spoke about doctors and frontline workers' lack of knowledge about migrants' entitlements. So you see, it works both ways, not only some of the migrants due to their language proficiency or due to the fact that they were unable to access information through internet, lacked kind of knowledge about their entitlements and services, but then also some of the stakeholders or some of the service providers were not knowledgeable about their migrants' entitlements to their services, which of course cause problems around accessing those services. So stakeholders spoke about doctors and frontline workers' lack of knowledge about migrants' entitlements. For example, migrants have been charged for services that they are entitled to or refused care. The way the hospital or the way in which hospital deals with that kind of situation, from what we've been told by migrants themselves who experienced those situations, was that they were often denied services, for example, in hospitals. But then when they seek help within certain NGO and they were going back in order to the place in order to access those services with someone from the NGO, with the knowledge and with kind of, if you like, a power to speak in English, those services were provided. So there was this kind of what I would call maybe power on decision maker who decides in services who can get service or not, and not based on their entitlement, but on basically a whim, if you like, or lack of the knowledge, yet again, by those service providers. Although many NHS frontline workers are up to date with migrants' entitlements to accessing healthcare in the UK, there are some who struggle with providing such care. For example, one of the stakeholders explained how migrants are turned away when trying to register from primary care, which is related with my one of the previous slides when I said that around 7% of our respondents were not registered with any type of practices. Here are some of the key findings that I listed. There's much more in our report, which is quite nuanced, and I encourage you to read it. But overall, migrants to Birmingham celebrated the diverse, welcoming nature of the city, were integrated socially, and gave numerous examples of contributing to their community, both economically and through voluntary work. However, there was a significant minority who experienced food insecurity, fear of crime, poor housing, and poor health, which appeared to be more prevalent than in the population as a whole. So we've done also kind of comparative research based on existing quantitative governmental data on health, and we could see that actually, in comparison with other places in the UK, some of the pockets of Birmingham were pockets of high deprivation, and also with minorities who are experiencing those insecurities that I just mentioned. And finally, support services were experienced at providing services to new migrants in the city, but faced challenges in promoting inclusive access to services, including translations and interpreting. And perhaps I will say just a word of acknowledgement, if I may. So as I said, this assessment was commissioned by Birmingham City Council, and Bethany Finch and Gillian Wright were really helpful in facilitating our research. Then we worked closely with a steering group that included various representatives from various NGOs across the city, but also members of Birmingham City Council Public Health. And I would love to say thank you to Mr. Priyar Rahman Mohammed, who was really helpful in navigating Kurdish community in Birmingham that is quite prevalent and under-researched. So that was fantastic. And then finally, stakeholders and migrants who participated and agreed to participate and share their experiences with us. Thank you.
Thank you so much. It's really fascinating work. Thanks. And if you have any question, we have around 10 minutes time. If you have any question, please use your microphone and ask or raise your hand. It's better to, yeah, Nazanin.
Thank you so much, Bozena. That was brilliant. I wanted to know, have you any plan to publish this article or present in any seminar?
Well, so of course this research was, or this assessment, as I said, not to confuse with pure academic research, was commissioned by Birmingham City Council. So we are in a process of negotiating and still talking about that part of our agreement, that we do have a draft that we can, I guess, share internally, but it's up to them if they want to publish it and kind of put it on their website.
Yeah.
However, according to also our agreement, we can use our data that we gathered for academic publishing, and currently we are, I want to say we are trying to work, mainly because I was really busy, and then Mahuja is smiling because she's my co-author as well with our other co-authors. We are trying to work on 2 papers, one based on, because there's so much information. We want to separate kind of quantitative part with qualitative part and prepare two papers. So yes, we are preparing it, although because I was really busy and it's my fault, we are a little bit late behind, but I will keep you posted whenever we'll publish it. We can share it.
Yeah, perfect. Thank you so much.
And I think also, you know, those type of assessments, what's interesting in doing this kind of type of work. It's the fact that it's very it's for practitioners really and commissioners. So the papers themselves also are going to be published in journals who are rather directed towards practitioners, like social workers, psychologists, and all that, rather than perhaps academic audience. So there's quite a lot of research on, I don't know, language proficiency and academic research and integration, or about specific types of migrants based on their basically status, legal status. So there's lots of research about UASC, as you know, that talks about their integration and their specific needs. So I think what's unique in this assessment is that it's very place-based. It's all about how local services could be maybe bettered. It's not conceptually, let's say, innovative, but it never planned it to be. But there are some interesting findings that I haven't mentioned, so I will definitely share the draft with you.
Yeah, I will do that as well when we are ready.
Yes.
Thanks, Bozena. Christina.
Hi, thank you. Thank you very much. So my question is, because you were saying at the beginning, and it's right, like the population of migrants is so diverse that then the experiences of all those migrants are going to be quite different. And yet the purpose of those needs assessments is to improve service provision. So I wanted to ask you, in terms of, for your recommendations or your final findings, how do you integrate all those different experiences and make sure that those who are most marginalized, because most of the time services are being improved for the majority, but we want to make sure that minorities and those who are most marginalized, they have that improvement. So how do you do it in practical terms as a researcher?
Yes, that's a fantastic question, Christina. And yes, I do agree. That's the thing, like one cannot really compare or even try to compare experiences of highly skilled migrants with asylum-seeking people who are not highly skilled, let's say, and not, you know, without language proficiency and so on. So it's difficult. So that's the thing that, you know, when this work was commissioned, what Birmingham City Council wanted from us is to try to speak with as diverse group of migrants as possible. However, those 30-odd interviews with migrants that we had, and then 74 surveys, are not represented and were not focused on particular group. So we have to remember, with that in mind, that it's impossible really to target specific type group of migrants through this kind of assessment. There's a need for, I don't want to sound like an academic, there's a need for more research. But I was thinking about this when writing our papers now based on that I would love to see kind of work by someone that gathers each and every research that has been done, let's say, over the last 5 years within migrant population in Birmingham, because there was lots, and there was lots during pandemic also in relation to you know, their experiences of, let's say, accessing NHS during pandemic. So I think this kind of systematic review of what has been done in 5 years, breaking this down based on type of migrants could help. But I agree, no, totally. Like some of the groups have so many specific needs. For example, there is a Syrian relocation scheme. So there are Syrian refugees now hosted in Birmingham. There is Afghani, this relocation scheme. Then you have Ukrainian refugees. And then you have this unaccompanied asylum-seeking children from, let's say, Eritrea. And those needs are their needs are very specific. So yes, I think there's a need for more focused work on those people who are most disadvantaged across the town. Something that definitely this JSNA was unable to do. We just indicated here are just very basic recommendations, but I chose a couple. We have more in our assessment. But yeah, I wish to see also this kind of systematic review of all research that has been done in the last 5 years. That I think could help.
Thanks. Jane, you raised your hand.
Thank you, Bozena. I'm just thinking, of the sort of political background that this is sitting in. So we have a very hostile national government who, is blatantly hostile towards some of these communities of people. So I'm just wondering, where does Birmingham City Council feel this fits with that? How are they hoping to bring about some change just locally, or are they hoping that this can start debates in a sort of wider national setting? What are the next steps for Birmingham City Council?
Yes, so I must say that the kind of migration division, if you like, of City Council is wonderful. I mean, their intentions are really great. Those are people who worked within migrants NGOs across the city for the last 20 years, and they are really trying their best to provide services to everyone in Birmingham. So I don't have any doubt in that. At least those people who I worked with, who we worked with. And that's why I included those people in acknowledgements, because I think they are doing great job. But of course, it's about, at the end of the day, it's about not only willingness but funds. And I think the issue is with funds. So I think local authorities are really trying their best, but they are dependent on the funding that they can get also. So a couple of years ago, there was this migration fund, which was part of really, if you like, hostile environment, this idea a couple of years ago, but local authorities were bidding for funding. And I know that, for example, Wolverhampton City Council got quite a lot of money to organize or provide services for unaccompanied asylum-seeking children and young people in town. And I spoke with some of them and asked them, do they feel like there's this conflict? Because it was our migration control fund. That's how it was called, that local authorities could apply for. So even if in its name, this hostile environment, it was purely linked with hostile environment. It was done by the government back then. So, but they applied for this fund, and I've been told, look, like, yes, we are not, and this is in Wolverhampton, and it was a couple of years ago, so probably different people work on UASC there now, so I can share with you that they said, yes, we do see a conflict, but at the end of the day, we need money for social workers. We have so many children in need. We need social workers, we need psychologists, we need interpreters, and this fund was open, so we applied just because we can provide services. So, but yes, there is this conflict. But from my experience, local authorities usually are trying their best. And with people with NRPF, for example, so what at least in England, by the way, I just published with my colleagues also toolkit for social workers working with people with an RPF in English. So I think I sent it to Mahuja if someone would like to access that. So those people are basically left for local authorities to deal with. And there's no money for that at all. So local authorities needs to kind of do creative accounting on somehow help those people who often are with children and end up destitute. But yet again, from what I observed on the ground, local authorities usually are trying their best. But yeah, it's like with this interpreting services, it's all about money.
Yeah.
But the willingness is there, definitely. Willingness and spirit is there, at least in Birmingham, Wolverhampton. But yeah, funding perhaps is not matching the willingness of them. I'm not sure if I'm replying to your question, but I guess, Jane, you also work with local authorities. So I wonder if you have similar observations to mine.
No, I tend to work much more with the voluntary sector, the community sector, if I'm honest. And I know that they absorb a lot of this in terms of, like refugee and migrant centre up the road from us, who try and, fill in the gaps for some of these people. I'm just aware, I suppose, sometimes you just feel a bit frustrated that we do this research and, we know that there are so many people in need, but there doesn't seem to be quite the political will and indeed therefore the budget to actually support them. So it just, you know, at the moment everything feels frustrating to me.
Yes, and there is this tension between within NGOs themselves and between NGOs, and this includes like cases like Birmingham. So there's a couple of very kind of nationally well-known NGOs or very locally well-established NGOs that they usually get funding. But there's also lots of fantastic smaller NGOs that work with particular group of migrants that half of their job is struggling to get any funding for providing the services, but on the ground, actually, they do the majority of the work. When we talk something, you know, beyond work by NHS, social work and all that, right? But with all of the other aspects of, let's say, integration, well-being, and information provision, those are the organizations that do great jobs, and those are organizations who are like praised by migrants themselves and city council as well, but they get the least money. So for example, there is this fantastic organization called French-speaking Africans in Birmingham, very tiny organizations, but during COVID, they managed to provide quite a lot of information for their community, or rather, without them, Birmingham City Council couldn't access those individuals. So, and this is a tiny organization who is barely surviving, but does tons of fantastic job on the ground. So I agree, this is frustrating that there is this first sector is left kind of behind, as like.
Thank you.